Pharmacology. Drugs have three names. The chemical name, which is the scientific name typically given to a drug when it's discovered that describes the molecular structure of that drug. The generic name, which is a non-proprietary name or abbreviation of the chemical name, such as acetaminophen. Finally, the trade name, or brand name, is the name given to the drug by the pharmaceutical company that makes the drug. In the case of acetaminophen, the brand name most of us are familiar with is Tylenol. The dose is the amount of the drug or chemical entering the body. This is usually given as milligrams of the chemical per kilogram of body weight. Remember the 6 rights of medication administration: the right medication, the right dose, the right time, the right route, the right patient, and the right documentation. Let's review some terms and key concepts. The term affinity is used to describe the attraction between a drug and a receptor. Drugs with a high affinity bind more easily to receptors. Drugs with a low affinity require a higher concentration of the drug to get a response. The drug potency is the amount of the drug that's required to produce a therapeutic response. The effective dose is the amount of the drug that produces a response in 50% of the people taking it. The toxic dose is the amount of the drug that produces adverse effects in 50% of the people taking it. LD50, or the medial lethal dose, is the dose required to kill half the members of a tested population after a specified test duration. The margin of safety, or the ratio between the toxic dose and the effective dose, is called the therapeutic index. The higher the therapeutic index is, the safer the drug is considered to be. In general, non-prescription drugs have a much higher therapeutic index than prescription drugs. Controlled drugs are rated in order of their abuse risk and placed in schedules by the Federal Drug Enforcement Administration, or DEA. The drugs with the highest abuse potential are placed in Schedules 1, and those with the lowest abuse potential are in Schedule 5. These schedules are commonly shown as C1, C2, C3, C4, and C5. Schedule 1 drugs are considered by the government to have a high potential for abuse, no established medical use, and a lack of safety for use of the drug even under medical supervision. Examples include heroin, LSD, cocaine, and marijuana. Schedule 2 drugs have a high abuse potential and severe dependence liability, although they do have accepted medical use but with severe restrictions. This class of drugs are available through signed prescription only and in limited quantities. Examples include opium, Ritalin, morphine, and methadone. Schedule 3 drugs have a less abuse potential than Schedule 1 and 2, and an accepted medical use by prescription only. Abuse of these drugs or other substances may lead to moderate or low physical dependence or high psychological dependence. Examples include codeine, short-acting barbiturates, amphetamines, phenobarbital, as well as anabolic steroids. Schedule 4 drugs have a low potential for abuse relative to the drugs in Schedule 3 and an accepted medical use by prescription. Examples include Xanax, Valium, Ativan, and Ambien. At the lower end of the spectrum are Schedule 5 drugs. These are considered by the government to have a low potential for abuse and a currently accepted medical use in the United States. Abuse of these drugs can lead to a mild physical dependence. Prescriptions may not be necessary, but transactions must be recorded. An example would be cough suppressants with small amounts of codeine, such as Robitussin, as well as other prescription drugs with small amounts of opiates. The cumulative action of a drug is the increasing effect that multiple doses of the same drug cause due to a buildup of the drug in the bloodstream. Hypersensitivity is a reaction to a drug that is more profound than expected. This oftentimes leads to an exaggerated immune response. Idiosyncrasy is a reaction to a drug that is significantly different than what was expected. Indication refers to the medical condition for which the drug has therapeutic value. Pharmacodynamics. Pharmacodynamics is the study of biomechanical, and psychological effects of drugs in the body. Most drugs work through interactions with receptor sites, which are protein coatings found on the outer surface of the cell membrane. These receptor sites receive a signal from the body's chemicals, such as neurotransmitters, hormones, and enzymes, which cause a molecular event to occur within that cell. Drugs either enhance, agonist, diminish, partial agonist, or block, antagonist, the generation, transmission, or receipt of a signal. Generally, when a drug binds or attaches to a receptor site, a chemical reaction occurs that initiates the desired physiological or therapeutic response. Such drugs are called agonists. Some drugs work by partially or completely blocking the chemical event through the principle of antagonism. In such cases, a drug competes with another drug or chemical for position at a receptor site. A classic example of this is naloxone or Narcan, which competes with narcotic drugs. In this case, Narcan would be an antagonist. Pharmacokinetics. Pharmacokinetics is the study of metabolism and action of drugs. How drugs enter the body, how they move through the body, and how they are eliminated from the body. Once a person has been exposed to a drug, the drug must get into the body and to its target site in an active form in order to cause an effect. Naturally, the body has defenses for such events, such as membrane barriers, biotransformation enzymes, antioxidants, and elimination mechanisms. The acronym ADME refers to absorption, distribution, metabolism or biotransformation, and excretion. Absorption is the movement of a drug from its point of entry into the body into systemic circulation. Factors that influence the rate of absorption include the concentration of the drug, the site of the absorption, the pH of the drug, the status of the person's circulation, and the solubility of the drug. Through inhalation, the drug is readily absorbed by gases and into the bloodstream via the alveoli. This is enhanced by the large surface area of the alveolar surface, the high blood flow, and the proximity of blood to the alveolar air. When a drug is ingested, absorption occurs through the GI tract. In the stomach, the drug has to compete with stomach acids. If it makes it to the small intestine, the prolonged contact time with the large surface area makes this a good location for absorption. Distribution is the manner in which a drug is transported from the site of absorption to the site of action. Blood carries the drug to and from its site of action, storage depots, organs of transformation, and organs of elimination. Distribution is influenced by cardiovascular function, such as heart rate and blood pressure, as well as physical barriers, such as the blood-brain barrier and the placenta barrier. Biotransformation is the process by which drugs are inactivated and transformed into a form that can be eliminated from the body. These inactive forms are called metabolites. The rate of transformation will determine how often a drug needs to be administered to maintain its desired effect. For example, epinephrine transforms in 3 to 5 minutes. Key organisms in biotransformation include the liver, which is the most significant, the lungs, the kidneys, and the intestines. Finally, excretion. Excretion is the process of eliminating drugs from the body. This is accomplished primarily through the kidneys, but may also involve the liver, the lungs, the intestines, as well as the sweat and mammary glands. Potentiation is the enhancement of one drug's effect by another drug, such as the way promethazine may enhance the effect of morphine. This should not be confused with synergism, which is defined as the combined action of 2 or more drugs that is greater than the sum of the 2 drugs acting independently. Refractory is the failure of a patient to respond as expected to a certain medication. The routes or sites of exposure or administration of a drug include ingestion via the gastrointestinal tract, inhalation via the lungs, dermal or topical via the skin, and injection either intravenous, intramuscularly, or intraperitoneal which is the injection of a substance into the peritoneum or abdomen. The typical effectiveness of administration from the most effective route to the least effective route is IV, inhalation, intraperitoneal, intramuscularly, ingestion, and finally topical. The therapeutic action of a drug is its intended action. Tolerance is described as a decreased sensitivity or response to a drug that occurs after repeated doses. When this occurs, increased doses may be required to achieve the same desired effect. Before we get too far in discussing the types of drugs, remember this rule in general terms. Drugs that affect alpha receptors typically affect our vessels. Those that affect beta-1 receptors typically affects our heart, and those that affect beta-2 receptors typically affect our lungs. Think alpha for veins, beta-1, we have one heart, and beta-2, we have two lungs.
Brought to you by EMSSuccess.com.